Good afternoon, sir.
Good afternoon.
Sir, firstly, I am welcoming you to this event IAPSMCON 2026.
Thank you.
As you all know, sir, during the health crisis, misinformation spread faster than the disease itself. So, I would want to request you, sir, to please give us the clarity on this and also few words about you and yourself, sir.
Okay. So, I am Dr. Shashwat Nagar. I am a professor of community medicine at a private medical college in Ahmedabad. And I have more than 15 years of experience in working in public health and community medicine. So, while we work with community medicine or public health systems, we also understand public health behavior. And with the growing times, the digital media has increased a lot. And what we have come across is that with the digital media and the social media, there is a lot of information that goes along with it. And a lot of that information, a significant proportion is coming from health.
Okay.
And sometimes, along with information, you also get misinformation. So when you have self-proclaimed experts, not genuine experts, or when you have informations which are not verified, we come across a situation which is called as an infodemic.
Okay.
And an infodemic basically means that there is excess amount of information. Just like in epidemic, you have excess amount of cases of a disease. Same way, in infodemics, you have excess amount of information about a particular topic related to health or disease. And this information, the worst part about is sometimes is not verified or not authentic in nature.
Sir, I would want to know why this misinformation is injurious for the health industry.
Okay. See, what happens is that sometimes when we listen to something
Yes.
in a short video or in terms of a reel, we generally tend to trust that information. And when we trust that information, we have not verified that information, but we trust it because we feel that whatever information we got is from experts.
Yes.
When we trust a given piece of information, our behavior also changes on the basis
Correct,
of
sir.
this.
Yes.
So people tend to change their health behaviors on the basis of misinformation. And this change in behavior can lead to either not going for a diagnosis early, not going for a treatment in time, maybe taking a wrong medication, taking a wrong step, expecting for something miraculous to happen, and that is when the problem arises.
Okay, sir. Sir, why this false information spread very fast than the scientific facts, sir?
Simply because of the reason that anything related to social media or mass media is related to sensationalism. If you sensationalize something, it spreads like a rapid wildfire. And then there is nothing controlling it.
Yes.
So most of the information that goes on social media actually goes in a manner of, in a sensation where people tend to accept that information rather than verifying the facts of that particular information. And that is why it spreads rapidly and people tend to believe that the information that they've heard is actually true.
Sir, what are the few examples of misinformation today, sir? Can you please tell us?
See, there are lots of examples, but one of the ones that are recently going on are related to lifestyle, related to nutrition, related to day-to-day health seeking practices, like how people take the treatment, where the people take treatment from.
Yeah.
That can be all from unverified sources and that can be from unauthentic sources.
Yes.
And incorrectly, they sometimes seek the treatment, even sometimes against medical advice because they heard or saw something in social media or in a reel.
Yes.
So, take for example, something related to a cancer treatment
Yes, sir.
or related to a grave disease which
Yes.
can have a significant health impact.
Yes.
So if you are not trusting your doctor or a medical professional for that particular treatment and you are taking a treatment from an unverified source, that can be dangerous.
Okay, sir. Sir, how this misinformation has changed the doctor and patient relationship, sir?
It has changed quite a bit because previously the patients used to go to the doctor, a doctor would directly start treating the patients. Now, before this thing actually happens, there is a small session between the doctor and patient in clearing patient myths. Because for any particular disease, the patient will first Google about that particular disease, try to read from different sources, and then we'll discuss and talk with the doctor about it. Now a doctor rather than focusing on the treatment of the patient, has to first waste the time in clearing the wrong concepts and myths and then come on actual treatment of the disease.
Okay.
So that is where the doctors have to deal with a double crisis
Yes.
of not only treating the patients in time,
Yes.
giving a proper amount of time to the treatment and managing the diagnosis, but they also have to clear their doubts which are related to social media.
Okay. Sir, I would want to know one more thing. Why the global agency are also very worried about this misinformation, sir?
See, the global agencies deal with lot of health situations
Yes.
and health problems. And when people change their behavior, the public health behavior, the public health systems or the public health problems also change. Say for example, taking something like an antibiotic.
Yes.
Most of the times people have a wrong practice of taking an antibiotic during common cold.
Yes.
Most of the common cold infections that we have, where we are coughing and sneezing,
Yes.
are actually virus borne and happening due to viruses which circulate in the community.
Yes.
Now, antibiotic is a drug which is antibacterial
Yes.
with limited or negligible antiviral properties. But people keep taking these drugs, and that too without prescription,
Yes.
without indication. And as a result, we are now dealing with a new health crisis or a new health problem which is called as antibiotic resistance. So now, when you actually get a bacterial infection and you take an antibiotic, it will not work.
Okay. Sir, one more thing I would want to know. Can misinformation outbreaks?
Misinformation cause outbreaks is what you are asking?
Yes.
Okay. So, yes, misinformation can cause outbreaks in terms of, again, talking about health behaviors. So, the kind of outbreaks that we normally face in the community are largely driven by the practices of the people in terms of drinking water or consuming safe food, or the practices related to respiratory tract infections. So all of these practices are also driven by misinformation, because people tend to have zero verification of what they are listening in social media and not confirming it from an authentic source. And that is why it is important, and the role of doctors becomes very important. And if they are active in social media and if they give the correct information, we can actually prevent such outbreaks or epidemics of diseases.
Okay. Sir, as a common people, how we can identify that this information is wrong or this is an infodemic, sir?
Okay, so that's a very good question.
Yes.
See, normally, as a part of general population, if you trust the doctors or the information which is coming from authentic sources,
Yeah.
like a medical practitioner or a medical professional, that can be trusted. But sometimes, if you want to confirm the information which is not coming from an authentic source or a medical source, then it is important to trust the evidence or the source of that information. And that evidence can be trusted with the help of either reading it from a known source, let's say a medical journal, or from a medical piece of information that comes in a medical booklet, or you can also read it from using AI tools, provided you judge your information on the basis of the published articles which is put in these AI tools. So you can utilize the AI tools, but provided the information is based on research articles or published articles, only then that information is actually evidence-based information.
Okay. Sir, what should people do before following the health information online, sir?
Yeah. So health information online, just like I mentioned, that
Yes.
health information online has to be first verified.
Yes.
And that verification should actually be done unless, see, if you have an access to information, the best case scenario would be you verify the source of information and then go ahead. But if you do not have that, then always it is better to follow the advice or the professional, whatever advice has been given by the medical professional or the medical doctors.
Okay, sir. As you yourself are a doctor, so I would want to know, sir, what is the roles and responsibility of doctors during the fighting with this misinformation?
Misinformation. Okay.
Yeah.
So first of all, it is important that doctors themselves become a part of social media. Nowadays, you see a lot of consultants and super specialists. They are a part of social media.
Yes.
They are consistently giving information.
Yes.
Right? And sometimes when there is a heavy circulation of misinformation,
Yes.
the doctors and the medical centers can come into picture by circulating their own correct information, also specifying the source of information. That is going to be not only an ethical but a socially responsible practice.
Sir, so are you saying that every doctor should be online, like they should make reels or information video or for social media to make public aware about certain diseases or information, sir?
Yeah, I mean, it can be done for at least common diseases which impact a large number of population. That can be done. There are a lot of practices in the people which is wrongly practiced. So at least those informations can be rectified, can be told to the population so that they do not do it, and the diseases which is impending may be prevented.
Sir, as we talk about the long-term effect, what is the long-term effect of misinformation, sir? How this can affect the people as a large, sir?
See, people at the large, when there is consistent flow of information, people generally tend to believe information emotionally.
Yes.
When you get it from a friend, or when you get it from a family member, or when you get it regularly in social media, you tend to believe that practice. Like for example, a lot of people say, "Sham ko dahi nahi khana chahiye."
Yes.
Right? And a lot of people practice that also. But in reality, if you check the evidence, dahi is a very important source of probiotic which keeps your gut healthy, and also it is an important source of protein in our diet.
Yes.
So there is nothing wrong in consuming curd at night, and there is most importantly no evidence, no research which backs that the curd should not be consumed in the evening. So I think on the longer run, if people tend to believe these practices and if they continue doing it, then it can cause outbreaks or diseases, and it can lead to sometimes panics
Yes.
in real life situations.
Yes.
If we deviate little bit from medical part, just see what has recently happened. There have been lot of bomb threats
Yes.
in schools in different parts of Gujarat, maybe in other parts of country also. So I think these type of situations where people believe rumors can lead to panic, and that can happen in the medical system also. And we have seen a little bit of that in COVID-19 also,
Yes.
where a lot of practices were unverified, they were done, and that led to a lot of panic in the population. So that should be prevented.
Okay. Sir, I would want to request you to give one message to the listener of this podcast, sir, that will help them to prevent themselves by, believing this misinformation, and one message just to people make aware about the industries.
Yes. So the main message which I want to give to everyone who is listening to the podcast is, do not trust anything that you hear. Do not believe or do not change your practice on the basis of everything that you hear. And just focus on the authenticity of the information that you hear. Validate the information. Listen from the experts. Believe the experts. And then only follow as a health practice.
Okay. Sir, thank you. I would really appreciate your effort and time. Sir, I would want to know, have you come Silvassa for the first time, sir?
No, I have come here for the second time.
Okay.
But no matter how often I come over here, I enjoy the place. I come from a big city, so coming over here makes me feel warm, makes me feel comfortable, and makes me feel full of attention. So I really like that.
Sir, our Honorable Prime Minister and our Honorable Administrator, sir, has poured their heart into this event.
That
sir.
is true. And it is evident. It is evident from the event, the meticulousness of the preparation, the way you people have organized such a big event, and being at such a center and organizing such a major event in such a short duration of time calls for a heavy amount of praise and appreciation to the people who have organized. And I want to thank everyone for having us over here at such a lovely place.
Sir, thank you for your effort and your time. We really appreciate, sir, for the information that you have given to us. Thank you, sir.
Thank you. Thank you.